the month of the mental health awareness. 9th was World Mental Health Awareness Day, and October is usually the mental health awareness month. So we thought we should have something basically on mental health, because mental health care is not a very widely appreciated field, as in most people don't take care of their mental health. Because we think that it happens on its own. It never happens on its own. We need to take care of ourselves. We need to take care of, like we take care of our physical health, we need to take care of our mental health also. So the idea behind this presentation is to actually give you pointers as to how you can do that for yourself, because it's all about self-care. I mean, you can't always go to a doctor, you can't always go to a psychiatrist, you can't always go to someone professional to help you. So you need to learn to help yourself out, so that you don't come to a point where you are going to have some problem with your mental health. Okay. So the essentials and importance of mental health self-care. Sure, all of you all have seen this poster. I mean, those who've got the mail or seen it on Facebook. So it's about caring for your mind. Okay. So if you're struggling, you deserve to make yourself self-care a priority, whether that means lying in bed all day, eating comfort food, putting off homework, crying, sleeping, rescheduling plans, finding an escape through a good book, watching your favorite TV show, or doing nothing at all. Give yourself permission to put your healing first. Quiet the voice telling you to do more and be more. I mean, what happens in our everyday life, because this is a fast-paced world, we are living in a fast-paced world, and we are living in a city which is a fast-paced city. People expect you to do a lot more than what you are actually capable of doing at any given point of time, and you tend to stress yourself to that point also, because you don't want to be wanting, you don't want to be less than anyone else. So you're constantly pushing yourself. It's not always good to keep constantly pushing yourself. You need to take breaks in between. You need to tell yourself, okay, this is as much as I can go. I don't need to go any more further than this, because I know my body is telling me, or my mind is telling me, that this is enough. This should stop right here. So you need to be aware of yourself. You need to inculcate that habit of being aware of your mental balance, your health in all aspects. So unless you become aware of yourself, you're not going to be able to do that. You're not going to be able to stop when you need to stop. So it's important to give yourself permission to do that. Put your healing first. Feel your feelings, breathe, and be gentle with yourself. Acknowledge that you're doing the best you can cope with, and trust that during this time of struggle, it's enough.
If a person is troubled, is not able to which way to where to go, which way to what is
the idea of doing this.
He could not decide.
Absolutely, the idea of doing this is so that you don't come to that point where you are coming to that breakaway point where you can't do what you need to do, or you can't make decisions, or you're so confused, you're thinking of other things, you're thinking of ending your life, or you're thinking of harming yourself in some way or the other, or you're harming yourself involuntarily, like you're pushing yourself to such an extreme that your body and your mind is saying, no, I can't take it anymore. So you can do anything, but not everything. That's an important learning that you need to realize. You are capable of doing anything at any given point of time, but don't try to do everything at one time. And self-care is very important. There's no health without mental health. So this is some kind of a pointer that it's kind of a self-care basket that you can make for yourself. Find or decorate a basket or container that you love. Add materials to build connection and creativity. Anything like stationery, note cards, address books, birthday lists, gratitude letters, photos, manicure, pedicure, loofah, razor, all these, whatever you do to keep yourself looking good and healthy. Journal writing, autobiography, photo or audio journals, sheet music to compose, play or record, whatever you do, creative stuff, whatever you do. Make a date with yourself, keep a time, and then start enjoying and relaxing yourself by doing those things that you love doing. Okay. So it's nice to have that in your life every once in a while. Take a break from your life, from your regular routine, and do the things that you love doing. You know, indulge yourself, indulge your mind, indulge your body. Mental health care is transforming. It's important because self-compassion is not the same as self-indulgence. So when we're saying take care of yourself, I'm not saying be indulgent, as in start overeating or just let yourself go. I'm saying do the things that will help you balance your mind and body. Become a priority in your own life. Most often what we do is we have so many things to do that we ourselves are a forgotten chapter. I mean, we forget about ourselves, and we're constantly trying to achieve things and do things for others, maybe for ourselves, but they are materialistic things. We're not doing things that are really necessary for ourselves. We're doing things which can improve our standing in society or improve other people's perception of us, but we're not really taking care of ourselves in that form. People with mental illness die earlier than the general population and have more co-occurring health conditions. 68% of adults with a mental illness have one or more clinical physical condition, and 1 in 5 have some kind of disorder or the other. More than 1 in 5. It's not selfish to love yourself. You take care of yourself, and to make your happiness a priority, it's a necessity. Mental health is real. It's not a joke. It impacts everyone, and it needs to be accepted, really. If we are facing in one direction, all we have to do is keep on working. So this is the mental health spectrum, where we take care all the contributing factors of that make us feel good about ourselves. Health, wealth, friends and family, playtime, hobbies and fun, relationships, careers, jobs, personal space, and spirituality.
What is contribution spirituality?
Contributing spirituality.
Contribution is
It's contribution.
contribution. So these are the different aspects of our lives, right? And we need to create a balance between these aspects for our mental health to be functional, for our mental balance to be effective. So unless we have that balance, we are not going to be able to live our lives perfectly or healthily. So how many of you do all these things? I mean, how many of you inculcate everything that happens in this spectrum? You do. Okay.
Most of the areas. but
Yeah.
not all.
Which is the one that you don't do?
Relationship, playtime,
Those are things that you do. Okay.
not much into spirituality.
Okay. That's okay. I mean, see, you might be doing something else instead of that. So that's fine. I mean, this is just a broad understanding.
In fact, all should be balanced, but we are not able to do that.
Yeah, because we tend to go extremes in some areas and just do the other things as some kind of a stopgap arrangement for our own self-satisfaction. If you look at it on a personal level, self-esteem, life purpose, environments, healthcare, play, work, finances, relations, stress, how we master stress, exercise, diet, and spirit are important aspects of self care. If you look at the self care wheel, the physical, psychological, emotional, professional, personal, and spiritual areas, aspects, it's much more clearly defined here. In the physical, can you see that? So why is mental health care so important? Because when we tend to stress our bodies and minds to an extreme level, what happens is we suffer burnout. Okay, our mind starts rebelling, and our body also starts reacting in that sense, and we start suffering burnout. There's compassion fatigue. There's vicarious trauma that happens. It depends on what kind of work you're doing. Mostly in call centers, and they suffer a lot of burnout because they're doing the same kind of
Time
work.
pressure.
The pressure is high, the targets are high, and they need to keep meeting those targets, and there's hardly any rest.
Their body is difficult to coordinate with.
Yeah, absolutely, because their timings are different. I mean, they have to work in night shifts, and those. So there's constant pressure on the body and the mind that's happening. So they usually suffer a lot of burnout
I
experiences.
think that is why they seek out for some short-term pleasures.
Absolutely, yeah.
That's what we hear.
No, actually, even the system allows for that. Actually, what they do is when they meet up to certain targets, the team goes out for a party, has drinks, socializes. So it's part of that system, the American system that they have in that environment.
But what happens? They forget about the moderation, and then subsequently, after some time, indulgence is more.
Yeah, because it's
And that
mostly a
becomes
very
habit.
young crowd. No, I mean it's not a mature crowd. It's hardly, very few people must be in their 30s. I think
Yes,
most of them will be between 20 and 30 in the call centers. So what happens is they're much more influenced by what is happening around them, and they're not able to balance what they should be doing and what they're doing. So that makes it much more difficult for them. The signs of burnout basically are anger and frustration, fatigue, negative reactions towards others, cynicism, negativity, withdrawal. If you look at symptoms, the symptoms could be physical, psychological, cognitive, and relational disturbances. And the key triggers are personal characteristics, work-related attributes, work organizational characteristics. If you look, when we talk about compassion fatigue, we're talking about people who are working in the helping professions, who are doing a lot of, dealing, doctors, psychologists, psychiatrists. They're working with people on a constant basis, and everyone who comes to them has some problem. It's not, and they start getting involved in that process itself of trying to heal that person. And when a person starts getting involved in that process, what happens is you start absorbing the negativity, absorbing everything within you. So that's why you start having compassion fatigue, because after a point, when they're working on a constant basis for so many hours a day, and especially doctors, they come to a point where they cannot feel that compassion anymore. It's like as though sensitivity is lost. It's a temporary phenomenon. It's natural and it's temporary. It's not necessarily a permanent thing. But what happens is, if you don't take care of yourself, then it can be a permanent thing. So because then you start building up walls within yourself, and then you don't
Or too much
allow yourself.
involvement mentally,
Yeah.
that also creates.
So that's what happens when you suffer. I mean, that's why you suffer compassion fatigue. So the signs of compassion fatigue are basically sadness and grief. You suffer from nightmares, avoidance, addiction, somatic complaints, increased physiological arousal, changes in beliefs, expectations, assumptions. You have a lot of guilt, detachment. You tend to experience a lot of detachment, and there's decreased intimacy in your relationships. Symptoms are usually physical, psychological, cognitive, and relational. And key triggers are personal characteristics, previous exposure to trauma, empathy and emotional energy, prolonged exposure to trauma, response to stressors, work environment, work related attitudes. Again, vicarious trauma is also related to compassion fatigue, as in people who are in this kind of situations, and when they experience when they come face to face with some kind of extreme situation where the person they're dealing with is in grave distress, and then you start identifying with that distress, and then you start feeling almost the same kind of experiences that the person is feeling. So it's like identifying with the victim, and then you tend to start behaving in that manner.
For giving a therapy, unless you put yourself in their shoes, you cannot understand the gravity also.
Absolutely, that's true. But what happens is, but you also need to you put yourself in their shoes, definitely, yes, because otherwise you'll not feel empathy. But you don't go to the extreme where you are the person. So you need to be able to hold yourself back up to a certain level, so that you don't start experiencing the same kind of trauma that person is experiencing. So, like we said earlier, read like we said in that comfort basket that you could have. Stress relief activities could involve reading a good book, watch your favorite film, engage your visual senses in painting or photography or any other creative pursuit. Allowing yourself to dream for at least 10 minutes and use visualization techniques. It's actually very effective. If you when we talk about visualization does anyone know about visualization techniques? Yeah, you need to. I mean, all of us have something, some place that we would like to go to feel relaxed, right? Yeah, some people like to go to the mountains. Some people like to face the sea. Some people like gardens, greenery. Those are the places that we would like to be in when we want to relax ourselves, or to a resort or wherever. I mean, or to a sanctuary or to some place. So you need to choose the place that suits you best and start imagining yourself in that place. Even if you take 5 minutes out of your day and start doing that to yourself, you will get that relaxation that you need. The actual experience of being in that place, you'll almost have it when you're in a stressful situation also. I mean, you can do that for yourself.
Yeah.
And that's a very healthy practice. You need to do that to yourself almost every day, so that you get those 5 minutes. Even if it's at 5 minutes, it'll help you balance yourself. Absolutely. Sit outside, enjoy the sounds of birds, listen to a favorite piece of music, listen to a motivational recording, play a relaxational CD. I mean, a lot of people like to listen to the Gita, or there are lots of recordings nowadays available. So, I mean, and with MP3 files and all, you can also listen to them on the computer. So you can play that when you feel you're going to a stressful period. If you play that, you will at once start calming down, and you'll at once start feeling relaxed and able to start thinking for yourself also. Listen to a radio program with your eyes closed. Sing, laugh, have a chat with someone who listens. Chew a piece of sugarless gum. Use deep breathing exercises. Eat a piece of dark chocolate. Chocolate's supposed to be very good to get you out of depression also. Use deep breathing exercises. Repeat affirmations out loud. Some people like sensory pursuits like aromatherapy and stuff. So if that's something that works on you, then use that also. Burn aromatherapy oils. Enjoy the aroma scented candles. Do some baking. The mixture of aromas and soothing moments will help. Enjoy outdoor smells from walks in the country or near the sea, and freshly brewed tea or coffee. Exercise. Squeeze an exercise ball, stress ball, sorry. Stroke a pet, particularly cats, dogs, rabbits. Wear soft, warm clothing. Play a musical instrument. Have a massage, yoga, or pilates. Sometimes you have to just let yourself chill. The dirty dishes will still be there later. So even if you have a steady routine that you need to complete every day, you should. It's okay to take a break and do it later on. It doesn't mean that you're procrastinating, or you're not doing your job, or you're not being disciplined with your life. It's okay not to be disciplined sometimes. Take your medicine, whatever that is that you need to take. Accept reality. You can't change the fact that you're sick. If you're sick, injured, or sad, or whatever the case may be, be ready to seek help. If someone is helping you, if someone is offering help, seek help. It doesn't matter. It's not about pride. It's about you. It's about taking care of yourself. Don't forget to laugh, even if life's not very funny in general. Find something to make you laugh a little every day. And if you are into comfort foods, then oatmeal, peanut butter, jelly, chicken soup, macaroni, cheese, smoothies, ice creams, mashed potatoes can help. They're basically all a lot of carbohydrates and sweeteners, so energy-giving foods. So it'll boost your energy levels. So this is how you make yourself relax. Step 1 is pick a focus word or short phrase to repeat to yourself. Step 2, sit quietly in a comfortable position with your eyes closed. Do you want to try it?
Yeah.
Okay, start. So pick a focus word or short phrase to repeat yourself. Sit quietly in a comfortable position with your eyes closed. Just relax and close your eyes. Relax your muscles. Keep them loose. Breathe slowly and naturally. As you exhale, repeat your focus word or phrase silently to yourself. Keep doing that. A few times. And if any other thought is coming into your mind, just reject it and gently turn back to repeating the focus word. You can continue this for 5 minutes, 10 minutes, 15 minutes, 20 minutes, as long as you need. Okay, and open your eyes and so were you able to do that? Were you feeling, how did you feel?
Fresh.
Yeah? How about you?
A little more relaxed.
Good.
So you can try this on your own. You don't need anyone to tell you what to do. You just have to do it on your own. Very often what happens, what stresses us most is because we are unable to say no to people. We tend to do more than we can actually do because of that very reason, because we don't want to reject anyone, we don't want to say no to people, and because we worry about what they'll think about us. But if you start worrying about what they'll think about you, you're going to neglect your health in that pursuit. So you need to first learn to say no when it needs to be said. I mean, if you know that this is not possible for you to do within the time frame that you have, or within your it's not within your capabilities, then you need to be able to say no to people, and you don't need to feel guilty about that. Setting boundaries is healthy. You need to learn to respect and take care of yourself first. Rest and self-care are very important. When you take time to replenish your spirit, it allows you to serve others from the overflow. You cannot serve from an empty vessel. So this is a self-care checklist. Do you overspend, overeat, or overindulge? Do you expect others to read your mind and meet your needs? Do you withhold success from yourself? Do you ignore your deepest desires but seek to fulfill others' desires? Do you ignore your real emotions and put on a happy face? Do you push yourself beyond reasonable limits? Allow others to emotionally, physically, or sexually abuse you? Deflect compliments? Say yes because you can't say no? Avoid time alone? Overexhaust yourself because of your need to feel important, needy, or worthy? Fear emotional intimacy? Try to do it all yourself, never asking for help? Try to appear perfect? So these are all the negatives. Okay, these are when you're not taking care of yourself. And if you look at the other side, do you take time for yourself? Allow yourself to make mistakes, to be open about your weaknesses? Ask for your needs to be met from a place of vulnerability. Spend time with friends, rest, play, exercise, eat well, spend money wisely, pursue your dreams, share honestly with others, enjoy and make time to enjoy and be intimate with those you love, forgive, allow others to be disappointed in you, appropriately express your emotions, including anger and sadness. Very often what we tend to do is we tend to keep our anger and sadness bottled up. We don't want to show others that we are angry or we are sad, but it comes out anyway in the way you behave, in the way you react to situations. Yeah,
It should be in moderation.
absolutely. Tell others what they mean to you. Be present for your children. Receive love from others. Say yes and no. Create a powerful support system for yourself. Celebrate accomplishments big and small. The best way to stay healthy and motivated is to offer gratitude for whatever you have, whether it's negative or positive, whether you view it negatively or positively, doesn't matter. But whatever you have today in your life, express your gratitude for it, and that will help you stay motivated and positive in your life. So what you need to do is, this is another exercise that you can try on your own. You need to fix an area, probably a neglected area in your life, whether it's your body, your mind, or any other, and so that's you first pick an area. So if it's your body, you decide on food, exercise, or whatever that you need to do. Write down what you already did well previously and what you could do to improve that situation from now on. So if it's your body that you're talking about, you can talk about food, exercise, or whatever you need to do. I mean, all the other comfort areas that we spoke about earlier. And if you're looking after certain aspects already, what you can do is you look at what you can improve on to improve your overall well-being. Okay, and that you can then make a plan for yourself, and a schedule, and tell yourself that okay, these are the areas that I will add on to my regular healthcare routine. I mean, we all tend to after the age of 40, I guess most people go to the doctor and or a hospital and get a checkup done, right? So that's one thing that you do to take care of your body. Find out whether you have any ailments, or whether there's a propensity for your body to move towards that zone, and how you could then prevent it from happening, or how you could then take care of that. So you need to develop a plan for yourself and fix areas where you think you're neglecting yourself, and then set an agenda for improvement and make that plan happen. That could be something you could do for yourself. Some reminders: your feelings are valid. You always survive. It's okay to cry. It always gets better. You're worthy of love. Breathe and be grateful. No feeling is final. Very often when we are in a crisis situation, or when we are in deep distress, what happens is we think that is the only experience that we're going to have from now on. We start to tend to think that that distress will go on forever, or because we really can't look beyond that. We don't open our eyes beyond that situation. So we need to realize that nothing is constant in life, not even distress, not even anxiety, not even any kind of experience that you're having. It's fluid. Life is fluid, and your feelings are fluid. Your feelings can't remain the same every moment in your life. If you're feeling sad today, tomorrow you might be happy. You might be even more ecstatic. You might experience different feelings over different time frames. So you need to realize that nothing is constant in your life. Don't allow negativity or distress hamper your thought process to an extent where you're thinking that is the only feeling you're going to have from now on. If it feels wrong, don't do it. Say exactly what you mean. Don't be a people pleaser. Trust your instincts. Never speak bad about yourself. Very often people with negativity tend to start talking negatively about themselves. They say no one appreciates me, and I don't think I'm good enough anymore, and that's a negative trend we tend to latch on to when everyone else is sounding negative about you. But everything about you can't be negative. Remember that. Trust your instincts. Never speak bad about yourself. Never give up on your dreams. Don't be afraid to say no. Don't be afraid to say yes. Be kind to yourself. Let go of what you can't control. Stay away from drama and negativity. And love yourself. Remember that everyone you meet is afraid of something, loves something, and has lost something. So you are not alone, basically. Nothing compares to a beautiful conversation with a beautiful mind. One of the most beautiful qualities of true friendship is to understand and to be understood. Working hard for something we don't care about is called stress. Working hard for something we love is called passion. And most of us do jobs which we don't care about. That's why we are so stressed out all the time. Because we're doing it for different purposes. We're doing it to make money. We're doing it to meet those needs that we have,
No choice.
Yeah. So you need to learn to balance that. So you don't obsess about that one aspect in your life. You need to start inculcating different things so that it can balance out the negative aspects of your life. We cannot become what we want to be by remaining what we are. With the right music, you either forget everything or you remember everything. This is a Japanese understanding of needs. So basically what it says is that all these aspects are part of our life, and we need to merge them to actually experience self-satisfaction. That which you love, passion, mission, that which you are good at, profession, that which you can be paid for, vocation, that which the world needs. So that's what will give you self-satisfaction, basically.
What is that ikigai?
That's a Japanese word, self-satisfaction. Yeah, that's a Japanese model for self-satisfaction. Yeah. So actually, it's self-actualization. So if you're able to bring those forces together, then you will achieve the things that you want to achieve, as well as you'll be happy with yourself. A lot of problems in the world would disappear if we talk to each other instead of about each other.
Yes. Most important.
Yeah. We tend to forget that all the time.
Most of the time.
The shortest distance between people is a smile. But we all refrain from smiling at other people because I don't know why.
Actually, this is because of our upbringing. Don't
Yeah,
smile to
yeah,
a stranger.
yeah. It's
And if you smile at stranger or anybody, your co-worker or maybe co-passenger, he has to smile back again.
yeah, absolutely.
90% of time he will smile back. Only 10% time he may not smile.
And that's how you build relationships. You're not going to make friends if you don't smile at other people. A lot of people who are coming from outside to work in cities, alien cities, they feel alienated because they're not able to make friends. And when they have problems, they have no one to help them with them. And they don't want to make that effort to make friends. Okay, people around them might have their own friends, but that doesn't mean they'll not be your friend also.
Who will take first?
Yeah, absolutely. So you build so many walls within yourself that you're not able to help yourself in those situations. So discover the possibilities for nurturing yourself. It's about you. So that's me. All of you will have yourself as the primary goal. So you look at your personal capability. Do I challenge myself and take steps to achieve my personal goals and grow in my skills? It's a question you need to ask yourself. In terms of physical nurturing, do I feed, groom, exercise, receive, touch and rest my physical body on a consistent basis? Limit setting. Do I hold myself and others accountable in ways that promote growth for all? Contributions. Do I feel that I'm contributing to my family or to my world in meaningful ways? Self-compassion. Do I practice gentleness and grace with myself? Do I accept my imperfections? Creativity. Do I set aside time to express myself in creative ways? Voice. Do I feel heard in my primary relationships? Am I speaking up in a way that people hear me? This doesn't mean just speaking loudly, it means speaking effectively. Adult relationships: do I interact, offer support, and rely on 1, 2, or 3 adults that I trust? So these are questions you need to ask yourself if you're interested in nurturing yourself. Maybe you're searching among the branches for what only appears in the roots. So what do you understand from that?
You are not going into the depth of what causes, what is the
Absolutely.
cause. You just go on to the searching of problems.
So you're looking at the surface and you're not going deep into. Moreover, what is happening is basically that we tend to get lost in that problem area that we are.
Symptoms.
Yeah, and we're not really looking at the real reason why it's
What
happening.
trigger?
Yeah, what trigger? Going through hard times doesn't make you strong. Smiling throughout each one does. So like we spoke earlier, meditation, eating chocolate, taking a shower, drinking herbal tea, making a phone call, maybe distracting yourself, coloring, writing, yoga, exercise, blowing bubbles, going for a walk, cleaning the house, listening to spa music, burning a lavender candle, reading positive affirmations, be mindful, and remember to breathe. A couple of good yawns and stretches also helps. Do puzzles like Sudoku or pyramid solitaire. Use a healing stone or a crystal for touch grounding. Walk outside, look at stars, and take in deep, clean, cold air breaths. Take in the silence and feel your breath. Fill your lungs slowly and completely. Exhale just as slowly. Be mindful of letting the tension leave you. Try to center yourself through breathing, saying on inhale, I am, exhale, okay. So basically that's a technique also for relaxation. So 9 ways to look after your mental health. Talk about your feelings. Keep active. Eat well. Eat healthy. Keep in touch. Ask for help. Take a break. Do something you're good at. Accept who you are. Care about others. Keeping in touch is an important thing because when we're living in a fast-paced city, when we have a lot of migrant people, a lot of migrants in the city, what happens is because they've migrated from different states, they lose touch with their friends of the past, and they come to a new place. They're not able to keep in touch with those people, or they feel that they don't need to keep in touch with them, and they think they'll make friends here, but here it's difficult to make friends because people are also busy in their own lives. So you need to keep in touch with your past friends also. That's how you nurture relationships. If you don't nurture those relationships, they're not going to be there for you when you need them. So you need to learn to keep those relationships going. You need to spend time on them and energies. Otherwise, you're never going to be benefited from. So one important aspect is social support, which we all neglect to a large extent nowadays because we're all from nuclear families, and most people are so busy working and they don't have time to spend with each other. Family, friends, your religious leaders, support groups, pets, animals, all these are helpful. Everyone can read that?
Yeah. What about the way?
Hmm?
You don't know about the rear rather than full back.
Can see? You can't see? Okay, I'll read. How to be there for someone with depression or anxiety? First point is know that you are needed and appreciated, even if it seems that you're not. I mean, if someone is depressed or anxious in your family, is suffering from anxiety, uh, you are needed. You need to help them and appreciated
How
also.
you can feel that? Because if you doubt that you are not needed, maybe may not be the correct or may be correct, then how you can get that feeling?
The idea is to say to
Even
yourself,
if you fake it,
no, it doesn't matter. The point is that person needs you, whether you accept it or not, and you have to offer that help to that person. Yeah. So the person, the idea here is to help that person,
Achha,
not to help
but
you.
I
Yeah,
took it in other way.
yeah. It's to help that person. Yeah. So you need to listen to them. Never say pull yourself together or cheer up, because that's what people do when someone is depressed, or they tell them no, you pull yourself up. It's okay. These things happen to everyone else. But that person is not ready to listen to all that. So love is good enough, but not tough love. Okay. Appreciate that it is an illness. Things will be said that aren't meant. I mean, when people are depressed, they say a lot of things, and or angry, or when they are anxious, they say a lot of things that might hurt you also. But remember that that's not really meant to hurt you. It's they just giving vent to their angst at that point. So you need to educate yourself and understand that this is an illness. So these are different mental health care professionals that are available in the city. So you can make use of them as per your requirements. There's a counseling psychologist, there's a clinical psychologist, psychiatrist, psychoanalyst, psychiatric nurse practitioner, clinical social worker, or your religious counselor. And if you look at a broader aspect of mental health care, there's a preventive aspect and there's the treatment and recovery aspect. So this is part of the preventive aspect. What we're doing today is part of prevention. If you don't like where you are, then change it. You're not a tree. I'm sure that's understood, right? I mean, so that's it. Are there any questions?